Everybody, hi, this is Dr. Ken Muich, Fibromyalgia Wellness Center. This is number 119 live video presentation on the subject of fibromyalgia and other related health subjects that are directly related to fibromyalgia most often. So if you had an opportunity to take a look at some of the comments that have been sending out to you, this has to do with, so you've been diagnosed with fibromyalgia. So now what do you do? And this is very, very important because I talk to so many patients and they don't understand actually fibromyalgia. And oftentimes doctors really don't give them proper information on the subject itself. So I thought I'd cover it for you in a very interesting manner. So is this a death sentence that you have all of a sudden you have fibromyalgia? You have all these different terms that people or doctors throw out to you. It's not a death sentence. First of all, okay? Do you catch this? Do you catch this like, this COVID-19? No, you don't catch it. It's genetic, believe it or not. It's in your system. You're born with it, okay? And I'll go into a little bit more detail. So who's your doctor? Who are you going to go to for this? Are you going to go to your home doctor, so to speak, the one that said, I think you have fibromyalgia, whatever, or whatever doctor might be? You need to find out his background. Has he worked with fibromyalgia patients? What does he do? Does he just dispense pharmaceuticals, or does he actually work with you on this condition? This is a health condition, okay? This is not something that, you just pick up off the ground, so to speak. You need to know that he knows the history of fibromyalgia. Actually, I mentioned so many times, it goes back to biblical times, but it just doesn't fit into what we call the allopathic form of diagnosis, where this is a type of diagnosis where, excuse me, everything else is not covered, and then whatever is left is fibromyalgia, because there's no objective test for this. It's all really subjective for the most part. What you tell the doctor, how you explain it, and so forth. I always keep on telling people, the most important thing is you spend time with the doctor and make sure he spends time with you. So you have to find out if your doctor really knows what fibromyalgia is. Does he have any research on it? Does he understand where it comes from? Fibromyalgia is a cyclic form of health problem that oftentimes comes very, very slowly. Since you're born with it, many patients don't even know they have it, obviously, because when they go to a doctor, because of varied symptoms, the doctors say, well, you have growing pains, or they'll treat you for this or that. And that's the problem with fibromyalgia, and you understand, is that it covers so many different body systems. The body system, central nervous system. It also talks about symptoms from dermatological, hair loss and rashes, musculoskeletal, where you feel like you've got the flu 365 days out of the year, and it moves all over your body. The miscellaneous areas that it covers also, as far as health conditions is concerned. Genital urinary. So it covers the whole spectrum of your body's problems, so to speak. So that's why so many doctors, MDs, DOs, allopaths, what we call them, really have a difficult time diagnosing fibromyalgia. And fibromyalgia, again, mimics at least a dozen to 15 other health conditions: osteoarthritis, rheumatoid arthritis, hypoglycemia, hypothyroidism, lupus, Lyme disease, so forth and so on. Many of the symptoms of those same conditions are the same ones that fibromyalgia patients have. So that's why if you go in talking about specific symptoms in a certain area, they'll diagnose you for that condition, even though they may not be able to find anything about any objective test. But since you're giving them all the symptoms from this, that's what they're going to actually deal with. So fibromyalgia, again, is a cyclic type of condition, varies from patient to patient. It's rare that the same patients come in with the same symptoms. They're all over the board because it covers so many of the body symptoms itself. So you have to understand that it's not the same. So even if your neighbor has it and you talk to him about it, maybe their symptoms are totally different from yours. There's no similarity, so to speak. A few of them: fatigue, body aches and pains, so forth and so on. But they may have hair loss, you may not have hair loss. You may have rashes, they may not have rashes, and so forth and so on. It's not an autoimmune disease. Okay, it's genetic. It's passed on. How we know this? Well, I work with a doctor that's been working with this for over 60 years, believe it or not. He has fibromyalgia. He's an MD out of California, the Fibromyalgia Treatment Center, and he, with his research out of UCLA, found that it's genetic, and it's proven because he's found that it runs from great grandparents to grandparents to children, parents, grandchildren, so forth and so on, all the way down the line. Now, that doesn't mean that your brother or sister may have the same symptoms again. That person, that other family member, may have very light symptoms, or they may be severe, depending upon the individual. Again, it's wide and varied. There's no specifics in this as far as exactly what a patient's symptoms are. And oftentimes, fibromyalgia patients have it evolve over a long period of time. Research has shown that fibromyalgia is made worse by some physical, emotional, or chemical trauma. We're going to be talking about that next week because it's going to cover something that is happening with this COVID-19 disease, believe it or not. Symptoms are basking over into these other individuals' symptoms that are very, very similar to fibromyalgia, so to speak. So it's genetically passed on. It covers multiple symptoms. Treatments are often relegated to controlling the symptoms itself of this condition. What we do in our clinic is we treat the condition. We know genetically what needs to be done, how it has affected the cells and so forth. And so we treat that, and that then controls and reduces the symptoms itself. If you have, and you do, if you have secondary conditions, osteoarthritis, rheumatoid arthritis, so forth and so on, all the different ones, genitourinary, whatever it might be, irritable bowel, chronic fatigue, they're going to be made worse by fibromyalgia. And oftentimes that makes it very, very difficult to differentiate one condition from another because fibromyalgia crosses over into all these other conditions and makes them worse. Isn't that horrible? It really is. So you have to understand your symptoms and your conditions and how they differ from one to the other, okay? The pharmaceuticals that MDs give, most times, oftentimes, they not only add additional symptoms because of the side effects that pharmaceuticals have, and sometimes they make your existing symptoms worse. If you look at the side effects of these pharmaceuticals, if it includes aches and pains, body aches and pains, and if you already have them, probably going to make it worse. If it has headaches, it's going to make them worse, so forth and so on. So look at the side effects before you do these. It's not an answer all. All the other Lyricas, Cymbaltas, Savellas, and all the other odds and ends and so forth that come out that are supposedly treating fibromyalgia have side effects, and many of those side effects are the same symptoms that you have. There is some natural treatments. Ours we consider to be natural only in respect that it's non-pharmaceutical, and so consequently it's very, very safe in itself. There are other treatments out there, and I've covered this before. You know, that people come up with, well, I take this and it works, and I take this herbal and so forth and so on. Is there research on it? Ask yourself, is there research, okay? And is it valid research? Is it research just by the company that made the drug? You have to ask yourself, is that valid research, okay? It may not be, because if they put money into this medication, they want to make sure they get it out on the market and they sell it. So you have to ask yourself, what is the research on this? Look it up. You know, everybody Googles everything. Look up the research on the different medications that you're taking. So there are symptom relieving medications out there, granted, for fibromyalgia. But again, look at the side effects, okay, and what you're doing as far as to be able to control these so you don't make your condition worse in itself. Very, very important that you understand that. So just because you've been diagnosed with fibromyalgia doesn't mean it's an end all and you're going down into the depths of despair and so forth. There are certain controls that you can take care of. Number one, make sure you get a doctor that is practiced in fibromyalgia. I have over 30 years. Dr. Saint Amand has over 50 years. And we have seen, you know, doctors usually say, well, I've seen almost everything. Well, we've seen almost everything, but not everything, because fibromyalgia is different from one patient to the next. You have to be able to diagnose fibromyalgia properly in itself. If someone diagnoses someone to have fibromyalgia first, and they come in our clinic, first thing we do is we make sure that they have fibromyalgia. So we go through a thorough history evaluation, examination, so forth and so on. A lot of questions, a lot of history to make sure that we understand whether or not the patient actually has fibromyalgia or some other condition that is actually very, very similar to fibromyalgia, many of those that I just mentioned to you in itself. So we make sure we take care of the patient properly and not just lead them down a path that is non-fibro. Okay, that's very, very important. You understand. So there's many things that you can do to help yourself. Many of them have to do with dietary things, as I mentioned to you over and over again, to reduce the inflammation out of your body. We know, science knows, that sugar, gluten, trans fatty acids, and dairy are inflammatory for many patients, for many people. Unless you take them out of your diet, you won't know whether or not they are affecting you adversely or not. So it's very, very important that you do that. If you have fibromyalgia and it's been diagnosed properly, you're going to have periods where it's going to get a little bit weaker, and then all of a sudden you have these what we call flares, where they really flare up because of one thing or another. It could be from the secondary condition you have. It could be because, again, the dietary things that you're taking. It could be because of the medications. It could be because of the weather. Weather affects fibromyalgia patients, and I've covered that. By the way, this is number 119 live video presentations. Go to YouTube, go to Fibromyalgia Wellness Center. They all are saved in one form or another on these stations. So if you look back and take a look at some of the subjects that we have covered, everything we could think of as far as fibromyalgia. As the patients come in, we learn more and more information that we need to get to patients, just like yourself or just like your family members, whatever. So it's very, very important that you look back at our old presentations. They're all about 15 minutes, 20 minutes, and so it shouldn't be taking too much of your time. That's the most important thing. So fibromyalgia, make sure it's diagnosed properly. It's not a death sentence. You don't catch this thing, not like a virus or bacteria, okay? You have to understand that fibromyalgia is something that is genetic. It's passed on. You're born with it. We're still trying to find, because genes are so difficult to work with, we're trying to find answers for the genetic aspect of it. But very few people spend very much money as far as research on fibromyalgia, because other than the Lyrica and Valsalvelas, the medications, there's not a lot of benefits from people. As a matter of fact, I haven't seen a fibromyalgia commercial on TV in months, I think. It seems like it's all rheumatoid arthritic, the psoriatic things and so forth. And so see more of yourself, so to speak. So fibromyalgia is becoming a second cousin, so to speak, kind of thrown down, thrown back, and it's not that important anymore, people, except for those people that have fibromyalgia, which is millions and millions of them, of which many are misdiagnosed, don't even know they have fibromyalgia. So if you need, look up Fibromyalgia Center, Fibromyalgia Wellness Center, okay? Dr. Kenneth Muhich, Kenneth, Muhich, for more information on our protocol, our program, because we have a lot of success working with fibromyalgia. Dr. St. Amant for over 50 years, myself for over 30 years, working with fibromyalgia patients to help them get back to as normal a state as possible. Once we do that, then it's up to the patient as far as to continue the program that we have with them. And we have a lot of successful patients. Matter of fact, I have videos on patients on my Facebook, on my website, that explain the successes that we've had as far as working with patients to get them back to be able to live as normal a life as possible. That which was lost is not lost forever when we deal with patients, because we work with them very, very closely. Next week, we're going to be talking about something that flows right into this. It's called the long haulers, believe it or not. It's an offshot of COVID-19. It is found, wait till you hear some of this information, I'm going to save a lot of it for next week. It is found that after the severe period of COVID-19, people get through it, all of a sudden they don't get better. things linger, and oftentimes they get worse. I'm just going to throw a few things out to you, like fatigue, fog, fibrofog, okay, lack of concentration. All right? Even the term chronic fatigue has been brought up. So we're going to deal with this in a much more detailed situation. So if you by chance have the COVID-19, need to look into this. Or for those people who haven't been diagnosed with fibromyalgia, this could very well be triggering the same thing, believe it or not. Because why? Some physical, emotional, or chemical trauma actually festers this lower level of fibromyalgia. Maybe patients never even knew about it, into fibromyalgia itself. So anyway, we're going to be talking about that next week. So tell your family, your friends, your doctors, your associates, anybody you know that maybe has fibromyalgia, to join with us next week as we talk about this. Thank you so very, very much. I want to wish you a very, very safe and enjoyable week. Wear your face masks. Don't listen to those people that say don't wear a mask. Believe me, we have to get control of this. It's still spreading because we open, as a medical professional, we open too soon, okay? And people don't have a lot of discipline, okay? They've been able to do whatever they want to do for the most part, stretching the laws. You know, I see a lot of people on Facebook saying, you know, you don't have to wear a face mask. It's our democracy. We can do whatever we want. Not if you're adversely affecting other people. You know, we're talking about vectors. We're talking about carriers that asymptomatic, don't even know they have it, could be giving it to other people. Blessings to all. Hope everybody has a safe and enjoyable week. We look forward to seeing you next Monday, 12:30 p.m., Fibromyalgia Wellness Center. Thank you very, very much. Have an enjoyable week, and goodbye.